students. Title of lecture today: Diagnostic significance of pulse and blood pressure measurement. There are two important vital statistics that the doctor used to assess the immediate health of your heart: blood pressure and pulse. This number fluctuates as your heart's condition change. Pulse is the rhythmical vibration of the arterial walls caused by contraction of the heart, blood discharge into the arterial system, and change of pressure in the system during systolic and diastolic. Pulse wave is transmitted due to the ability of arterial walls to distend and collapse. Anatomy and physiology. Vessels circulate blood to and from body and lungs. Great vessels: aorta, pulmonary artery, superior inferior vena cava, and pulmonary veins. Please see on this picture where you see main artery and hemodynamics of the heart. Anatomy of physiology. Two circulation systems distribute oxygen to body: pulmonary and systemic. Arterial pulse, arterial pressure, systolic, diastolic pulse pressure. On this picture, you see upper system capillaries, superior vena cava, aorta, pulmonary artery, and other vessels. Heart rate may be measured at a number of points as shown in the adjacent figure. Radial is most commonly used. We know such place to measuring heart rate: carotid, brachial, radial, femoral, popliteal, posterior tibial, dorsalis pedis, and other. Exam and findings: peripheral arterial palpation: carotid, brachial, radial, femoral, popliteal, dorsalis pedis, posterior tibial. Palpate for artery characteristics: rhythm, contour, amplitude, symmetry, variations. Radial pulse. To measure the radial pulse, use the first and second finger with the patient's arm well supported. Count from 15 to 30. If irregular, count for full 1 minute. Note rhythm and amplitude. Normal pulse, usually around 72 beats per minute. Remember, the pulse is affected by common factor join the dental setting: stress, anxiety, body temperature, maybe high rate of normal pulse, physical activity, pain. Adult males pulse rates about 72, adult females from 76 to 80, newborn up to 140, children about 19, and elderly from 50 to 65. Another convenient locally to measured high rate is the carotid. It's difficult to find right using the term. Arterial pulse influences volume of blood ejected, distensibility of aorta, viscosity of blood, rate of cardiac emptying, and peripheral arterial resistance. Pulse may also be different when similar change occur in the brachial or subclavian artery, or due to compression of large arterial trunks by the aortic aneurysm, mediastinal tumor, retrosternal goiter, or markedly enlarged left atrium. The smaller pulse we may lack in time. If the pulse on the two arms is different, further study should be carried out on that arm where the pulse wave is more pronounced. The following properties of pulse are examined: rhythm, rate, tension, feeling, amplitude, force, and waveform. Pulse: rhythmic or regular, arrhythmic or irregular. In healthy subjects, cardiac contraction and pulse waves follow one another at regular intervals. The pulse is said to be rhythmic or regular. When the cardiac rhythm is absent, the pulse wave follow at irregular intervals. The pulse becomes a rhythmic or irregular. Pulse rate. Pulse rate is normal condition, corresponds to the rate of cardiac contraction, and is from 60 to 90 per minute. If the heart rhythm is accelerated, tachycardia, the number of pulse waves increases and the pulse rate increases, accordingly pulse frequency. Pulsus rarus. Slow cardiac rhythm, bradycardia, is characterized by the respective flow of the pulse, pulsus rarus. The pulse rate is continued for 1 minute. If the pulse is arrhythmic, the heartbeats should also be counted and compared with the pulse rate. During frequent and irregular contraction of the heart, some systolic of the left ventricle can be so weak that the blood is not ejected into the aorta, or the amount of the discharged blood is very small and the pulse wave does not reach the peripheral arteries. Pulse deficiency. The difference between the heart rate and pulse is called the pulse deficit, while the pulse itself is called pulse deficiency. The greater the deficiency, the worse is the effect is produced on the circulation of blood. Pulsus durus. The fourth, this should be applied to the pulsation artery to compress it completely, determines pulse tension. The higher of the systolic arterial pressure, the more difficult it is to compress the artery, such a pulse is tense, pulsus durus. Pulsus mollis. If arterial pressure is small, the artery is easy to compress and the pulse is soft pulsus mollis. A normal pulse is of moderate tension. Pulse filling. Pulse filling shows the artery filling with blood or how the diameter of the artery changes in the period of dilatation and collapse. The evaluated pulse filling proximal finger should press the radial artery gradually. The distal finger determines its maximum volume. Pulsus plenus. Pulsus filling decreases, pulsus vacuus, in abnormal circulation and blood loss, contractive dysfunction of the heart. If the stroke volume and the total amount of circulation blood increase, pulse will be full, pulsus plenus. Pulse amplitude magnus altus. Pulse amplitude force implies its filling and tension. It depends of the pulse volume, fluctuation of the arterial pressure during both systolic and diastole, and tensibility of the arterial wall. Large, bounding, pulsus magnus or high pulsus altus. Pulse is characteristic of aortic incompetence, hyperthyroidism, fever, etc. Pulsus parvus filiformis. The pulse becomes small. Pulsus parvus is aortic or mitral stenosis, tachycardia, heart failure. The barely perceptible pulse is called to read pulsus filiformis. It occurs in shock, heart failure, and massive blood loss. Pulsus equalis. In a normal condition, pulse is rhythmic and uniform, pulsus equalis. In cardiac rhythm disorders, when the heart contracts at irregular intervals, the pulse wave becomes non-uniform. This pulse is called unequal, pulsus inequalis, pulsus alternans. In rare cases, in rhythmic pulse, high and low pulse wave alternans. This is alternative pulse, pulsus alternans. It is believed that this pulse is due to alternation of heart contraction that vary in both. It usually occurs in severe myocardial affection. Pulse form contour. Dependence on the rate of change in the arterial pressure during systolic and diastole. A rapid pulse, pulsus celer or pulsus silence, in characteristic of aortic insufficiency, since in this condition the stroke volume and systolic pressure increase, while during diastole the pressure falls rapidly due to blood regurgitation into the left ventricle. Pulse in such cases is not only quick but also high, pulsus celer and altus. Rapid pulse. is less characteristic of hyperthyroidism or nervous strain. Slow pulse is, on the contrary, characteristic of aortic stenosis. Blood ejection from the left ventricle is difficult and the pressure in the aorta therefore increases slowly. The pulse may decrease and the pulse is therefore not only slow but also small pulsus tardus and parvus. Pulsus paradoxus. Pulsus paradoxus is characterized by smaller pulse waves during inspiration. It develops in cases with adherence pericardium due to compression of large vein and decreased blood filling of the heart during inspiration. After examination of the radial artery, pulse is studied on the temporal, carotid, femoral, popliteal, posterior tibial, dorsalis pedis, and other arteries. It is important in suspected affection of these arteries, arteriosclerosis obliterans, thrombosis, and other. Exam findings, peripheral arteries, assessment for arterial occlusion, insufficiency, claudication, pulses, abroads, loss of body warmth, pallor, cyanosis, collapses superficial veins, and atrophied skin, loss of hair. Sphygmography. Pulsation of the vascular wall is recorded as a curve and sphygmograms of a healthy individual have a sharp upstroke, the anacrotic wave, a peak of the curve and a gradually declining downstroke, the catacrotic wave. The catacrotic limb of a peripheral sphygmogram has small waves, one of which is more pronounced and is known as a dicrotic wave, which is due to repulsion of the blood from the closed aortic valve during early diastolic. A central sphygmogram differs from a peripheral one by a pre-anacrotic vibration, a strip anacrotic wave, a pronounced catacrotic in caesura corresponding to closure of the aortic valve, and a small dicrotic wave. In interpreting a sphygmogram, special attention should be paid to the shape of the pulse wave, the rate of ascent of the anacrotic wave, and descent of the catacrotic wave, the amplitude of the pulse wave, the height of the dicrotic wave. This is very interesting picture. Please very attention. See on this picture there are the characteristics of the pulse. Capillaroscopy. Capillaroscopy are examined by inspection and scapullaroscopy, which is the method of study capillaries in intact surface, epithelium coats, skin at the edge of the nail bed or mucosa. Slight magnification microscopy with common diffuse daylight illumination or special capillaroscopy may be used. The capillaroscopic picture changes during vascular spasm, congestion, and in diabetic mellitus. Normal venous pulse. Hence, a normal venous pulse is negative. Positive venous pulse is observed in tricuspid incompetence when the maximum accent of the curve on the sphygmogram corresponds not to the systolic collapse of the vein but to the positive V wave. The vein swells during ventricular systolic. Phlebography. Venous pulse is studied by inspection. Phlebography is the recording of venous pulse. Phlebograph of the jugular veins show the activity of right side of the heart. Anatomy and physiology. Jugular pulse pressure, jugular pulse components, a wave, A wave, C wave, V wave, X slope, Y slope. The normal jugular venous pulse included an A wave caused by right atrial contraction, a C wave reflecting carotidic arterial pulsation, and X descent. The V wave, which corresponds to isovolumetric right ventricular contraction and is more marked in presence of tricuspid insufficiency, and a wide descent, which occurs as the tricuspid valve opens and ventricular filling begins. In sphygmogram and phlebogram are taken simultaneously. The maximum ascent of the normal sphygmographic curve corresponds to the negative deviation of the phlebogram because arterial diastole and blood flow into the atria from vein begin during ventricular systole. Auscultation of vessels. The artery is first palpated and then auscultated by a stethoscope without applying pressure. To sound can be heard on the carotid and subclavian arteria in healthy person. Peripheral artery exam and findings. Auscultation sites for roots, temporal carotid subclavian, abnormal aorta, renal, iliac femoral arteries, brew types, transmitted murmurs, obstructive arterial disease. The first sound is due to the tension of the arterial wall distended by the running pulse wave, and the second sound is transmitted onto this arteria from aortic semilunar valve. One systolytic sound can sometimes be heard on the femoral artery. Two sounds may be sometimes revealed on the femoral artery in aortic insufficiency. This double sound, Traub's doublet tone, is generated by intense vibration of the vascular wall during both systolic and diastole. Systolic murmur, produced by aortic stenosis, is usual when transmitted into the carotid and subclavian arteries, associated with decreased viscosity of blood and increased flow rate. For example, anemia, fever, hyperthyroidism can also be heard on these vessels. Sometimes appears in stenosis of aneurysmal dilatation of large vessels. The Vinogradov du Rosier doublet murmur can be heard in aortic insufficiency over the femoral artery when it is compressed by a stethoscope bell. The first of these sounds is stenotic murmur, which is due to the blood flow through the narrowed by the pressure of the stethoscope vessels, while the second sound is explained by the accelerated black flow to the heart during diastolic. Neither sound for murmur are normally heard over veins. A permanent blow or humming murmur may be heard over the jugular veins in anemic patient. It is produced by accelerated flow of blood with decreased viscosity. It is better heard on the right jugular vein when the patient turns the head in the opposite side. Blood pressure measurement. Elevation of systolic pressure over 140 mm and of diastolic over more than 90 mm hydrargium is called arterial hypertension. A drop in the systolic pressure below 100 and of diastolic below 60 mm hydrargium is known as arterial hypertension. Systolic diastolic pulse pressure. We have stethoscope for measurement of arterial pressure, equipment needed. Various models are available. The Bell site is best for blood pressure measurement, but simple model only have a diaphragm. There are various types of sphixa available. The most accurate and reliable being the mercury column, never digital increasingly accurate. Blood pressure is taken using an instrument called a sphygmomanometer, which consists of a cuff that can be filled with air, a hollow rubber bulb that pumps the air, and a glass tube containing a column of mercury. After placing the cuff around the upper arm, the doctor holds a stethoscope over the artery just below the cuff. The pulse can be heard. Next, air is pumped into the cuff, stopping the flow of blood through the artery. Then air is slowly let out of the cuff, letting the blood flow again. The pressure with which the blood begins to flow represents the pressure of the heart's contraction. Now at the systolic phase, more air is let out of the cuff, muffling the sound and representing the pressure of the heart relaxation. Applying cuff. Remove clothing from upper arm. Arm should be well supported. Sphere should be at high of heart. Apply cuff snugly. Inferior border of cup to 3 centimeter above antecubital arteries. Locate brachial pulse. This will mark the position of the stethoscope. Measuring blood pressure. Inflate cuff till radial pulse disappears. Note pressure reading. Deflate rapidly. Weight 36. Re-inflate to previous pressure plus 30 mm hydrargyrum. Slow begin deflating cuff. Note beginning of sound. Continue deflating till sounds become muffled and disappear. Note continue deflating. What is blood pressure? The force of the blood against the walls of arteria. These two phases are measured using two numbers, which stand for millimeter. The column of mercury in the glass tube rises and falls with the flow of the blood. The height of the column is measured as millimeter. The first number, which is higher, is taken when the heart beats during the systolic phase. The second number is taken when the heart relaxes during the diastolic phase. Normal blood pressure ranges from 110 to 150 mm as the heart beats, over 60 to 80 mm as the heart relaxes. Patients with reading that exceeding either of this range are treated for hypertension, high blood pressure. Reading below either of these ranges indicated hypotension, low blood pressure. This does not usually require treatment. Blood pressure may be decreased due to constitutional properties in asthenic persons, especially in the upright position. Orthostatic hypotension. Hypotension occurs in many acute and chronic infection diseases. Addiction diseases is a sudden drop in the blood pressure is observed in profuse blood loss, shock, collapse, or myocardial infarction. Systolic pressure alone sometimes decreases, while diastolic pressure does not change or even increases. Very interesting picture from systolic arterial pressure from 120 for systolic, and second diastolic to 80 millimeter. Expected venous pulsation, tricuspidal regurgitation, constrictive pericarditis, venous obstruction, insufficiency, maybe cases thrombosis, edema, varicose vein, access for content, pain, swelling, tendons over musculars, engorgement of superficial veins, erythema, and autoanotic. Diastolic pressure, pulse is difficult to find. Systolic blood pressure may increase, loss of vessel elasticity. In elderly, is pressure greater than maybe 140 to 19. Common abnormalities, older adults, arteriosclerosis obliterans, and venous ulcer. Thank you for your attention.